My name is Padraic. I'm a urological oncologist. I did my residency training at the University of Toronto in Canada. Following that, I did a 2-year Society of Urological Oncology fellowship at Weill Cornell Medical College in New York, Hospital Presbyterian, New York. And then I went to practice back in Canada and now returned down to the US to join the UF Health Urology. My main interest in urology are urological oncology, so that deals with cancers of the genitourinary system. Primarily I focus on bladder, looking at open and robotic techniques as well as what are called continent and incontinent diversion, so how we basically put people back together after we take out the bladder. The second thing I mainly focus on is kidney cancer, both localized as well as advanced kidney cancer. So these are sort of the smaller cases as well as larger, more complex cases. And then I also deal with a number of other GU malignancies that people have to suffer from. So my research interests basically are in 2 areas. One, looking at population outcomes, which is basically we look at a bunch of patients who have had treatments and we look at what sort of things impact how they've done. And instead of focusing on the patient, I focus on sort of system issues or disease issues. So whether a patient had insurance or not when they had their surgery, their age, as well as things like how far they live from the hospital, and how we can sort of fine-tune those things to sort of achieve better outcomes down the road, or what other areas we can look at apart from the patient that we can improve the patient's outcomes. That way it's not always on the patient. The second area I look at is interventions. So putting some of those things into practice, but it's also interventions including clinical trials where we look at new classes of drugs, where we make new therapies available. And I like to tell patients that it's basically, it may or may not help them, but certainly it will help us deal with people in their situation, people like them in the future in a much better way. So that's sort of the 2 areas that I focus on in research. So I think, when you look at UF Health Urology, there's a couple of things that stand out. One is, I think, an overwhelming sense of collegiality amongst all the faculty here. You've got a lot of people who have expertise in their own areas, and I think rather than working as separate individual silos, everyone likes to work as a team. And so we sort of help each other out. And I think that goes a long way, not just for job satisfaction for us, but more importantly, it also goes a long way to achieving the best outcomes for patients.